How does a scoliosis develop? There are different types of scoliosis, and the types of scoliosis are normally determined by their causation. Idiopathic, neuromuscular, degenerative, and congenital are the four main types when we look at scoliosis. Now, the most common type of scoliosis is something that we call idiopathic scoliosis. Idiopathic scoliosis accounts for 80% of all known scoliosis cases, while the remaining 20% are associated with something that we call neuromuscular, degenerative, and congenital scoliosis. Let's talk about idiopathic scoliosis first. Now, idiopathic scoliosis means there's not a clearly associated single cause for the scoliosis. From a structural standpoint, we know these curves actually start to develop very young in life. They may start at a very, very small curve, only like a few degrees, and something causes the curve to initiate. This causation is debatable. We really don't know. It's considered to be a multifactorial problem. There's many different theories and many different causes in terms of causation of idiopathic scoliosis, but something causes this curve to start. And once the curve starts, it becomes structural. Whatever causes the curve actually may go completely away, but the curve stays there. And as the person grows, the curve unfortunately can grow with them. So what are some known causes of scoliosis? Well, neuromuscular scoliosis is by far probably the most common that we associate a known cause. And this is when a patient has the presence of a larger neuromuscular condition, something like spina bifida, muscular dystrophy, cerebral palsy, Ehlers-Danlos syndrome, Marfan syndrome. These are connective tissues, neurological disorders that can be associated with the development of scoliosis. Degenerative scoliosis is another type that's known by a known cause, and this is when the spine shifts out of alignment and this part of the spine degenerates faster than the rest of the spine, leading to something called degenerative scoliosis. And it's the accumulation of that area degenerating over a period of 10, 15, 20 years that causes this curve to occur. And the last type is something called congenital scoliosis. And congenital scoliosis is when you're physically born with scoliosis. And this is when one of the bones of the spine in utero develops into a malformed shape. And this malformed bone is called a hemivertebra, and this can lead to a scoliosis developing. And normally it's diagnosed, or it's there at birth, but it can be diagnosed very young in life. Now, when we look at causes of scoliosis, the causes of scoliosis are not always what caused the scoliosis to worsen. Meaning, if we theoretically say that a patient develops scoliosis because of a lack of a nutrient, let's just say a lack of vitamin D. Not that I'm saying lack of vitamin D causes scoliosis. What causes the scoliosis to worsen isn't the continued lack of vitamin D. It is a very specific time, and that's when patients go through growth. We know the most specific time curves worsen is during growth, and it's this increasing growth that causes this curve to progress rapidly. So we know scoliosis is progressive, and it's going to be progressing regardless of what caused it. And this was in its nature to worsen over time. In this growth phase, curves can progress relatively rapidly, and they can progress to relatively severe stages. The problem is we have no way of knowing which ones will or which ones won't. Curves under 25 degrees that go through the growth phase, one of every three progress to severe standards. Once you break 25 degrees, now 2 of every 3 progress to severe standards by the time they're done growing. So we know the size of curve, the bigger the curve is during growth, the more likely they are to worsen, but we can't predict it. Meaning if I see 100 patients with 10-degree curves going through growth, I can't tell you which one's going to become 20, which one's going to become 30, which one's going to become 40, which one's going to become 50. We have no idea. So because we know this growth phase during this adolescent stage, 10 and 18, is by far when curves go through this rapid progression. It's this progression that brings, this is the most common type of diagnosis that tends to occur, something that we call adolescent idiopathic scoliosis. And it's because they're progressing rapidly in this stage, it's the most commonly diagnosed scoliosis because a curve needs to be a certain size for it to be diagnosed, meaning curves that are like 10 degrees, 15 degrees are so that they're so small and so subtle in their effects, they normally don't see any kind of postural deviation. So therefore, a curve has become to a certain size. Most curves, for them to be detected posturally, have to be over 25 to 30 degrees. In fact, I remember reading papers and studies that say 30 to 35 degrees is the average size of diagnosis. So curves are normally not diagnosed at a small stage. They're normally diagnosed at a relatively significant stage. We also know this adolescent idiopathic scoliosis scoliosis is more common in females. It's a 4-to-1 ratio. For every 4 girls, we see 1 boy. And females go through a growth spurt faster and younger. So they go through a quicker growth spurt younger in life than boys. So we know in this short, rapid growth spurt is what causes curves to progress quicker. So females are designed to go through that type of process. So unfortunately, they're more likely to experience progression because they go through a shorter, faster growth spurt. Now, when we look at scoliosis and you're diagnosed, most patients wait, well, is there a way to stop curves from progressing? Well, we don't know why scoliosis develops. So there's no treatment that can cure scoliosis because we don't know the cause. And whatever causes that scoliosis starts it could be gone, but now growth is what causes it to progress over time. So even though we don't know what causes it and we can't guarantee cures, but we do know if we can treat the scoliosis and reduce the curve, we can have a proactive approach to how much the curve progresses during this growth phase. So like I said, curves under 25 degrees, 1 of every 3 worsen. Curves over 25 degrees, 2 of every 3 worsen. So if we can keep curves small, we can directly reduce the risk of progression during this adolescent stage. So a proactive treatment works on counteracting the progressive nature of scoliosis. And the best way to counteract its progressive nature is by reducing the size. Now, not only is this true in adolescent, this is also true in adult stages. We know the bigger the curve is in the adult form, the more gravity affects it, the more it progresses. So in adolescent or adult stage, we know smaller curve is better, bigger curve is more likely to worsen. So first and foremost, since scoliosis is a structural condition, we must impact scoliosis on a structural level. If you're experiencing any symptoms as a result of your scoliosis, like pain or muscle stiffness or discomfort, treating the symptom and leaving the curve where it is not a structural approach. It's reducing the curve. Now, we like to use very specific chiropractic approaches to help reduce scoliosis using chiropractic therapies, rehabilitations, and adjustments that are designed for scoliosis to help achieve a structural result. Once this structural reduction is actually achieved, then we focus on strength and stability, meaning reducing the curve and letting it go, curves will progress. We have to reduce the curve and stabilize it. And we stabilize this with something we call specific scoliosis-specific exercises and therapy, and this is done normally in a home basis to help surround and stabilize the scoliosis. We can also use corrective bracing. This can be very effective in growing spines, but we also use it in adult spines to help augment the corrective results by continuing to push the spine into a corrective position, and in addition to help stabilize and improve the shape of the patient's torso and body. If we can change the shape of the torso of the body and reduce the curve and stabilize it, now we have an idea of getting a strong reduction over time. And lastly is customized home rehabilitation. This combination of all these different types of treatment allow us to produce predictable results in reducing a curve. Once we reduce the curve, we can slow down and stop its progressive nature and reduce the risk of progression. So it can be hard for patients to really understand that a majority of patients that we diagnose with scoliosis will never be able to tell you the cause. And actually, we can sit here and argue the theories on causation. But the truth of the matter is, once scoliosis occurs, in the vast majority of patients, the causation really won't alter the course of treatment. I like to compare scoliosis to something like an earthquake, meaning when earthquakes occur, we know exactly why. The plates shift and the buildings, shakes the earth and the buildings collapse, causes structural damage to those buildings. If we were to go in there and realign those plates, those buildings wouldn't be redeveloped. We still have to structurally repair the buildings. This is very similar to scoliosis, that whatever causes this structural misalignment to occur, it may resolve itself, and now the patient is growing with a curved spine. By the time we diagnose it, what caused it is now not necessarily relevant in most of cases. What's the structural component of the scoliosis needs to be treated. And this is even true in neuromuscular cases when we know what's causing it. Like we could say they have Marfan syndrome. We know the Marfan syndrome is a result of their scoliosis. Well, you don't treat Marfan syndrome and the scoliosis gets better. You still need to treat the scoliosis as a scoliosis. So the most important decision when we look at treating a scoliosis isn't always looking for the cause. It's looking for the most appropriate treatment at the right time to get the best response to reduce the risk of progression. So therefore, you're not dealing with a more severe case and more invasive treatment options as curves progress. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.